So that was a very interesting and good presentation you created there, but I think what's lacking here is lucidity in terms of, okay, you ask the question, what can we do to make it less costly? Well, follow the money. Where is the vast majority of the money going? If we pay more as a nation for healthcare and we're not getting it, and there are other nations which pay much less per capita for healthcare and they have universal coverage, where's the money going? The answer is the money is by vast majority going not for health coverage, not to the doctors, not to actually, you know, medicate people or provide for their health. By vast majority, all the money is going into a black hole, which is essentially the insurance companies themselves, i.e. the insurance companies are making a profit. So if you want to cut costs, cut the middlemen. And that's really a fundamental systems theory absolute truth. Whenever you have somebody in the middle between the patient and the doctor collecting money for whatever reason, it's money into a black hole. And that's what we've got. We've got millions and billions of dollars, trillions of dollars even, being sucked into the black hole of the insurance companies, and they're just in it to make profits. They're not in it to help people. They're not in it to have people be healthy. They're in it to make money. So they're making money off of people suffering, and people aren't getting health coverage. So how do you get lower costs? You cut out the middlemen. It's very, very simple, very, very fundamental. And the way you do that, there's a couple different ways. You can go for a public option. You can go for universal single payer. You can have the states do their own versions of universal single payer. Dennis Kucinich kind of put a thing in there. I hope it stays in the bills they're considering, where the states would have the option to go ahead and do state-by-state universal single payer. So there's a lot of different ways to go about it, but ultimately what it comes down to is you need to get the money directly from however we're raising that money to the doctor instead of from the raising of the money to the health insurance, to the other people, to the middlemen, to the, that's the way you cut costs. So there it is, how to cut costs and get rid of the middlemen.